Good evening, everyone.
Good evening, ma'am.
Good evening, ma'am. Good evening.
Good evening, ma'am.
Good evening, all of you. Okay. So yesterday we have learned eye-related procedure, that is strabismus surgery, and also we have learned the coding guidelines for stereotactic radiosurgery and chemodenervination, and also thyroidectomy, like endocrine system procedure, and few more procedure we have already discussed. And in today's class, we will see few more concept, and after that we will discuss practice questions. Okay. So the first concept for today is neurostimulators. So as you know, what is the function of neurotransmitters?
Ma'am, to conduct the nerve signals.
Yes. Okay. So they are chemical messengers. So they'll send the signal to one nerve to another nerve. Okay, that is the function of neurotransmitters. So same way, neurostimulators. So here, neurostimulators is the medical device. It delivers electrical impulses to the specific parts of the nervous system, and intracranial neurostimulators are implanted in brain or cranial nerve areas to help to treat the neurological conditions such as Parkinson's disease, dystonia, or essential tremors. That system typically includes electrodes, pulse generators, and sometimes programmers for electronic analysis and adjustment. So you can see, like, this is also a device. So if you take pacemaker, in the pacemaker also we will have the two compartment. One compartment will be having electrodes and another compartment will be having pulse generator. Okay, same way in the neurostimulator device also, they will be having electrode and pulse generator. So we need to check the particular procedure on which basis or where they are implanting. Okay, so we need to check whether they are coming for revision or replacement. So we need to carefully check what exactly they are doing, and accordingly we will be having the CPT codes. And one more thing, in this we need to understand array. So array refers to group of electrodes that are arranged in a specific pattern or a sequence. In this case of neurostimulators, an electrode array is a collection of multiple electrodes implanted in the brain or near nerves to deliver electrical simulation or stimulation to the targeted areas. So the word array is important. Okay, so as they defined, the electrode array is a collection of multiple electrodes. It will be having multiple electrodes in it, and like wherever they implant, maybe it nears to nerve or in the brain, it will function to deliver electric stimulation to the particular targeted areas. So we do have coding guidelines. So for example, if the question about electronic analysis of implanted neurostimulator or pulse generator system, we will be having codes from medicine section. Okay, other than neurostimulators, I'll explain that later. So if they directly question about electronic analysis, we have the code from medicine section. And coming to coding guideline, if they utilize this microelectrode recording, it will be inclusive. Okay, microelectrode recording will be an inclusive service of this neurostimulator procedure only if it is done by the same physician. Okay, whoever implanting it, if they are only performing microelectrode recording, then it will be an inclusive procedure. But if another physician involves, okay, if example you can see neurophysiologist, So if the other physician comes and take the recording, then we may have to code that micro electrode recording separately. Okay, so we do have codes in the medicine section for electrode recording. So we may have to take that particular code. So this is one coding guideline. So whoever performing the primary procedure and the particular provider only capturing or recording microelectrode analysis, then that will be included. Okay, if someone other than the primary physician, if they are performing or if they are recording this microelectrode, then we may have to code it separately. So I'll just show the codes. So whatever the guidelines I have explained. So you can just see the codes 61850, 860. So this goes on from 867 will be the neurostimulator code. So as you can see, twist drill hole or burr hole. So yesterday we have learned this. Okay, twist drill hole and burr hole concept we have already learned. So which one is the faster method? Burr hole or twist drill hole? Twist drill hole faster. Okay, that will be performed in the emergency procedure. And burr hole will usually take longer time. Okay, and again here craniectomy or craniotomy. So this procedure also we have learned in yesterday class, and you can read the description of this. So here, if you see 61863, twist drill hole or burr hole, craniotomy or craniectomy with stereotactic implantation of neurostimulator electrode array in subcortical site. Okay, subcortical site. So site is also important. I mean, where they are implanting the neurostimulator, that is also very important. So and then we have so without use of intraoperative microelectrode recording, first array. And additional array 61864. If they insert one more array, like as I said, array includes group of electrodes in it. So each additional array 61864. And 61867, twist drill hole or burr hole, craniotomy procedure or craniectomy with stereotactic implantation of neurostimulators electrode array in subcortical site. Again, example include thalamus and globus. So it goes on. Just see the another variation. So here it is. So you can just compare 61863 and 61867. So what is the major difference here? 63 and 67.
Microelectrode using.
So one is with usage of intraoperative microelectrode recording, and in 863 they are not using intraoperative microelectrode recording. Okay, without use of intraoperative microelectrode recording. So in question you need to check anyway. If they specify only twist drill hole, or if they only specify burr hole, or maybe if they say only craniotomy or craniectomy, still your code remains same. Okay, the only variations we have is it with micro recording, or I mean micro electrode recording, or without micro electrode recording. Okay, these variations we need to check. And how many array being implanted, that also we need to check. And 61867 corresponding add-on code is 868, each additional array 61880. This is revision or removal of intracranial neurostimulator electrode. So what they are doing here, revision or removal. So they can remove, or maybe they are adjusting. Okay, so then you can go with 61880. And 61885 is for insertion or replacement of cranial neurostimulator, pulse generator, or receiver. And 61886 with connection of 2 or more electrode array. Okay, the first one 885 is for single electrode array. 61886 is for 2 or more electrode array. Okay, so that's it. I'll show one question. So read the question and try to answer. So see, take 1 minute or 1.5 minutes. Read it and try to answer. So they are saying an incision is made in the scalp. Craniectomy is performed to access the area where electrodes are present. The electrodes are removed and the surgical wound is closed. Okay, so option B 61880. 61880 is correct. Okay, so it clearly says revision or removal of intracranial neurostimulator electrodes. So easy, 61880. I think everyone gave correct. So option B is correct. Okay, one more big question is there. So try to read and highlight the keywords. Okay, so as you already know, you need to check the site, and you need to also check micro electrode recording is there, like with usage of micro electrode recording or without. Okay, these are the keywords. So read that and try to give the answer. Okay, so if you read the question, I'll just try to highlight the keywords. So the provider is recommended, a trial of deep brain stimulator electrode is recommended. The patient is placed in a head holder adapter for the frame. The skull is incised, exposing the skull using perforator to make single burr hole. Okay, so burr hole they have performed, and the size, the burr hole size is 2.5 centimeter from the midline at the level of coronal suture, exposing the dura, and it is punctured for access. So micro electrode recording, MER. Okay, in short, they'll mention MER. So micro electrode recording and stimulation is done. Okay, so and then they have targeted and reposition the electrodes to determine the best placement for the neurostimulator electrode. And what is the position? Neurostimulator electrode array is placed in the thalamus. Okay, so I think this is enough. So what will be the answer?
867.
Okay, 61867. So easy, as you already know the keywords. 6183 is without use of intraoperative microelectrode recording. 867 is with use of intraoperative microelectrode recording. So this is correct. Okay, since they have used MER, you have to go with 61867. Okay, only single array is used or additional array have used? Single they have used. Okay, single array they have utilized. So you just have to code 61867. Okay, this is correct. So whoever gave option C, so you're all correct. Understood, right? Neurostimulator.
Yes, ma'am. Yes, ma'am.
Okay. So next, one more concept we have, that is pump implantation. Okay. Then, so these codes describe the procedure related to implanting or managing